it's Jessica DaMassa with WTF Health. I am here at Webit in Sofia, Bulgaria, and joining me right now I have Mark O'Herlihy. He is the Managing Director for WTF Health Europe. Yes. Hello.
How are you doing?
Good. All right, so you're going to give us a reality check on AI.
Yes.
From WTF Health Europe.
So,
all right, tell it to us.
A reality check. Okay, so I think there's a situation in the industry right now where people are seeing it as a concept as opposed to a product when they need to look at it as a way to solve problems.
Okay.
So I think there is an element of. Please go ahead.
So we were gonna so what you're saying when you say that, because I want to unpack it a little bit. So when you're saying that we're expecting a product, so we're expecting like tea leaves that are going to just show us something amazing, an app or whatever. We're waiting for this data to be delivered, and you're saying no, that we actually need to like have a question that needs to be answered.
Yeah. So everything's about an outcome. So it's about patients. We have to go back to that in healthcare. We have to go back to patients as opposed to the tech. And in most cases, people say to me, "I have this problem," and they go, "You don't have that product." But that's not what AI is about. So it's about an algorithm, it's about looking at information, it's about finding that information and creating an outcome from it, which is meaningful for them.
Right.
So I think if we can get away from thinking AI is a product, and it's more of an ability to create an outcome, we're going to be much better off.
Okay, how do we pivot our mindset? What do we need to start doing to change our thinking about this?
A very easy answer. We just have to be more transparent with people about what's going on.
Okay.
So I think it's become a bit of a secret for people. They feel like AI.
Yeah.
People turn up to presentations because it's a secret.
Right.
But actually, there's a lot of really good stuff going on. So I think as an industry, but also as a person, we have to be more transparent. We just have to say, look, even the research we're doing, we have to tell people what we're doing. And I think, it's really easy to be negative about new things, new waves, because we've been there, right? Big data and analytics kind of went up, went down. We look at genomics now, and it's in the middle ground, but it's still there. It's really important. And I think if we're more transparent, we're less polarization, I think.
Well, I think there's always this pressure, right, for innovation to like hurry up and get there and be first to market and whatever. And there is a lot of secrecy around that. And sometimes it becomes the technology looking for a use case instead of vice versa. Right. And so what you're saying is kind of we need to stop for a minute and pivot our thinking.
Yeah, we need to pause and we need to actually, and again, it's us as an industry need to be more transparent, right? So there's some great stuff going on. We're doing some great partnerships with research organizations, but then we need to say why we're doing it. Because I think there is an element of everyone's trying to solve the big problems, but there's loads of little problems out there that people aren't getting attention to. So we're doing more engagement around data science. Okay. I just spoke to a clinician earlier, and he said, look, my problem is not what you have. My problem is this. And that's data science. That's looking at his information and understanding and how to fix it. And yeah, AI is a component of that because it's just a way to wrap up. That's what it is. It's AI because AI is about learning, right? And then the next stage is about reasoning, and then it's autonomy when we get to robot world. But fundamentally, it's about learning. It's about learning the information you have and making more and more better and better decisions on that basis.
Okay, what's happening at WTF Health in Europe then? Give me an update. What are some of the whys that you're chasing after right now?
So the big things really are population health. Okay, so we again.
And how are you defining that?
Yeah, so it's based on understanding not just your regional population, but your clinicians and providers in those areas. Okay. So, for example, we've got a heart disease issue in the north of England. For whatever reason, I know why we have it. I won't do this on the camera, but we have a heart disease problem. So, have we got enough cardiologists up there? Okay. So that's one way to look at population health, which is actually we've got the right resources in the right places. Yeah. Another way to look at it is to go, okay, stop looking at cohorts, start looking at people. So you can actually say, look, there's a high incidence of rickets in this area, why? And then you can go back into the community and say, let's fix that over here. So I think it allows you to be more predictive. So looking, again, it's data, it's accessing information, it's regionalizing it, because you can't make a global data set that's relevant. You have to make a regional data set. Okay. Because people are different in different places. They have different socioeconomic diets, everything.
Data is local all of a sudden.
It has to be local.
Okay.
Yeah.
From the big data guy.
Oh, yeah. I'm not big data, remember?
Oh, that's right. Okay, so I want to ask you, I want to pick your brain a little bit about what else is happening in AI kind of around the world. I mean, we're seeing there's a lot of startups. It seems like the last 3 years, it's been an explosion of every startup's got AI with the data on the blockchain and blah, blah, blah. So, I mean, what's your take on this? Is this market going to get saturated? Are we in danger of setting ourselves up as an industry for another EMR issue where things are not interoperable? I mean, are we in danger of having dirty data that's, corrupted over time, or some of the biases that you see with that, that can be inferred from the AI when it's applied?
Yep.
I mean, tell me a little bit, I guess, give me a beat of some of the things that you're tracking.
Okay, so I'm not against it. I think it's important to have loads of innovation. In many cases, I've spoken about the fact that it is a partnership. You can't get away from the fact that very intelligent people make very good technology, and it could be one or two people in a company. And that wave has gone. The big company wave has gone. We partner with them. We create an ecosystem. So for us as a large organization, it's creating an ecosystem of AI. So bringing those partners through, helping them, giving them a leg up. I do think there is a danger of saturation. I mean, to answer your earlier question, I think there is, but again, it comes back to what I said earlier, which is stop trying to build products. Because actually the value of AI is to go into an organization and say, look, what's your biggest problems? How can we help access information to give you a better outcome on your biggest problems? And I think we're creating a lot of products right now. Yeah. And it is a buzz. And like every buzz, you're going to get loads of companies coming in. But I think as long as we continue to be transparent, I think people will start to work it out. They'll start to work out that tech companies building tech and AI generally isn't the right way to approach a problem. It's focusing on a big problem, right? Focusing on an area that actually is going to get benefit from that.
AI as a service all of a sudden.
Well, you could. Well, I'm not saying that. You said that. But why not? I mean, why can't you have a centralized service that you can send information to get a result? I mean, that's not against the realms of possibility.
No, not at all.
Right, but again, we're very product based, not as a company, but as an industry. And I think if we focus on data and analytics and solutions, you'll get to the products, right? But we're too far ahead of it right now, in my opinion.
All right, well, thanks for the reality check, Mark. We love hearing from somebody who knows. Thank you so much.
Thank you.
I'm Jessica DaMassa with WTF Health here at Webit with Mark. Thanks so much for joining us.